Presidential Steering Committee announced that all federal government employees should make a choice as to how they can contribute towards making the work environment COVID-19 free. The logical choice is between taking the vaccine and showing evidence of this, or presenting proof that one is COVID-19 free by showing a negative PCR test results which was taken 72 hours prior. This provision is applicable to all federal government institutions and employees. We should not be concerned about the availability of vaccines because the supply chain has been analyzed, and we're confident that the vaccines that are required to vaccinate these federal government employees, and even more than these specific numbers of government employees, has been figured out. It is now time for people to understand that government will do all that is necessary to protect the most vulnerable in our society. Even though there have been questions about whether this is mandatory or compulsory vaccination. It cannot be compulsory when you have been given the option of showing a negative PCR test. So the choice is really up to the individual which works best for them. We are cognizant of the fact that some unscrupulous elements will want to get the card and not the jab. We are working with relevant security agencies to make examples of these individuals who may wish to buy or sell cards by ensuring that we name them and we shame them. We are also enhancing the security features of our vaccination cards in order to limit forgeries. The agency has put in place plans to establish mass vaccination sites across the country. The objective of this strategy is to vaccinate a high volume of individuals through sites such as federal government institutions, universities, for example, polytechnics, shopping malls, religious centers, sports events, conference centers, and markets. This will require strong collaboration between the NPHCDA, state governments, religious bodies, school authorities, and governing bodies of malls and large sporting events. We encourage all eligible Nigerians to avail themselves of the opportunity to get vaccinated. I am glad to inform you that we have commenced the process of decentralizing COVID-19 vaccination in Nigeria to include private healthcare facilities. The decentralization will not affect the federal government's free vaccination policy. COVID-19 vaccines will continue to be administered free of charge at both government and private health facilities. The vaccination cards are also free. We acknowledge the fact that private health facilities may need to charge for their hospital registration cards. This is different from the COVID-19 vaccination cards. We have also begun the training of health workers in the selected private health facilities and the sensitization of critical stakeholders to create awareness and sensitize them on the plan and the criteria for involving private sector in COVID-19 vaccination and secure their buy-in. NPHCDA is putting measures in place to ensure close and effective monitoring and supervision of all participating private health facilities to ensure that the standards that we have set are not compromised. Interested private health facilities will be required to meet certain criteria, including having requisite qualified and trained health workers and evidence of a cold chain system that will keep the vaccines potent. Any erring facilities will be identified, they will be sanctioned and will be blacklisted from participating not only in the COVID-19 vaccination, but also in our routine immunization processes. Vaccines are an important tool for public health interventions. we will not compromise the quality of delivery of these tools to all Nigerians. It is our commitment to Nigerians, it is our promise that we will uphold this commitment.